So for those who saw on Monday night, running back Nick Chubb for the Cleveland Browns took a pretty nasty hit to his left knee, and he basically dislocated his entire knee. So really at this point, we're really concerned for a PCL injury, which is the back part of your cruciate ligaments. Your ACL being your anterior cruciate ligament. So your ACL and PCL is really what we're worried about for Nick, as well as the outside stabilizer, his LCL, which he's injured before in the past. So when we look at how these particular injuries are treated, they're typically done in two different operations. So they're staged out. The first stage will be to reconstruct one of the ligaments around his knee. The second stage will occur about 12 weeks later. And then what they'll do is they'll go back and they'll reconstruct the other part of his knee. So, he's looking at about a 9 to 12 month recovery minimum. So obviously out for 2023, but with the hopes of coming back for the beginning of the season for 2024. So when we talk about post-operative recovery for these are pretty significant cases, and they're really tough to treat for a multitude of different reasons. So a lot of the guys that I've worked with struggle a lot with the mental part of things and not getting frustrated. The physical part, we're looking at things like minimizing scar tissue after 2 different knee surgeries within the knee. We're looking at reducing swelling, and then we're also looking at really firing back up that quad muscle before we start to recondition him back into gameplay. Given that he had a pretty similar injury back when he played in college, it'll be interesting to see how this plays out for him long term. Now, obviously, with the NFL and this high level of play that he currently plays as a professional athlete with the Browns, it's going to be full throttle. We're not really too concerned about what he's going to look like in about 10 years. However, given that he's now had 2 knee dislocations, the likelihood of him forming some arthritis is pretty high. So definitely something to think about in the long-term future for Nick.